everyone. If we could call to order the Public Safety Coordinating Council meeting for Friday, November the 15th. Mr. President, at this time, if you could do a roll call, please.
Ms. Holt,
Here.
Sheriff Cronister,
Colonel Wayne Bunton for Sheriff Chad Cronister.
Chief Judge Figueroa, Mr. Warren,
Here.
Judge Jeske, Commissioner Merman,
Here.
Ms. Frank,
Doug Backey on behalf of Ms. Frank.
Mr. Bates,
Here.
Mr. Parkinson,
Here.
Ms. Lewis,
Here.
Chief Dugan,
Eli Vasquez for Chief Dugan.
Ms. Grant,
Here.
Ms. Royston,
Sandra Pinckney for Judy Royston.
Ms. Ulrey,
Antoinette Hagley here for Miss Ulrey.
Ms. Campbell,
Here.
Colonel Bunton sitting in for the sheriff,
Here again.
Chris Daniel,
Here.
Ms. Condemo,
Here.
Mr. Eakins, Mr. Proctor,
Here.
Councilman Dingelfelder, Senator Rousen, and Ms. Justice, are you sitting in for?
Yes,
Chief?
ma'am.
Okay. You have quorum.
Thank you. Just as a reminder, if everyone could please silence their phones, and if you could also speak directly into the microphone for the public awareness. Okay. In your packet are the minutes for the May 15th, 2019 meeting. If you could please peruse those, and if we could have an appropriate motion. Motion to approve by Mr. Warren, a second by Mr. Bates. Is there any discussion on the motion? Are there any additions, corrections, or deletions that need to be made to the minutes before the motion is voted on? All in favor of the motion, please say aye. Aye. Anyone opposed? Okay, thank you. We have no old business, and under new business, we can start with the nomination of new officers. Ms. Preza, if you could explain the process, please.
We will now hold nominations for chair and vice chair of the Public Safety Coordinating Council. Pursuant to the PSCC bylaws, the election of officers will be held at the January meeting. Only those members who are statutorily required to be on the PSCC may be nominated. The names of those persons are listed on the memorandum before you. May I have nominations for chair?
I move we have Julianne Holt as our chair.
Second.
Do I have a second?
A nomination by Commissioner Merman and a second by Mr. Warren, the State Attorney.
May I have nominations for vice chair?
Nominate Sheriff Cronister for Vice Chair.
Second.
A nomination by Mr. Bates for Vice Chair by the Sheriff, Chad Cronister, with a second by our State Attorney, Mr. Warren.
The election will be held at the next full council, which is going to be on January 24th. Thank you.
Thank you, Ms. Preza. Also in your packet, we have the 2020 proposed dates for the master calendar. In order to shore up those dates on your calendar, if you could for a moment just take a glance at those dates in your calendar to see if there are any dates that cause any problems. I know that January 24th, by that time the legislative session is obviously in full swing. However, usually on a Friday, we shouldn't have any problems in having a quorum. The other dates, if anyone has any other comments or concerns. Having heard none, then we will consider these to be our meeting dates. The full council will be at 8:30 on the 26th floor, which is where we are today at the County Center, with our executive committee meetings being held at 8:30 on the 18th floor here at the County Center. And if you could put those on your calendar at this time, we would certainly appreciate that. Also in your packet is a list of subcommittee member lists, which includes not only who the chair might be as well as the vice chair, but the different members. If you could glance at those for a moment and see if we should make any corrections or deletions. And so I would just point out, so for instance, as it relates to the Alternatives to Incarceration Committee, Mr. Warren, you have Renee Marotti as your designee. If there's a preference that you be the named person for this committee, and then if you're not available, to have the designee we can do that. Just take a look at it from that standpoint. Anyone have any comments, any suggestions, any thoughts? Anything they'd like to see changed? Any committee that they feel is not appropriate at this point for inclusion in the Public Safety Coordinating Council?
Madam Chair, we'll probably have some names from the state attorney's office that we adjust.
All right, then what I would ask, Mr. Warren, just that you just give Ms. Preza, shoot her an email, and she'll make those adjustments, and we'll try to finalize a list no later than our next meeting. Any other comments, suggestions, thoughts? If you change your mind, or if you go back and you talk to other individuals and you feel that a change needs to be made, again, just please email Ms. Preza, and she'll certainly advise me, and we'll make the necessary changes. At this time, now we are going to have a briefing on the 1800 Orient Road project about the Healthcare Department, and is Mr. Early available for us? Good morning.
I'm totally available for you.
Wonderful.
He drives from,
Well, we truly appreciate you being here this morning, but just so that you know, this was a suggestion that was made at our executive council, because we really wanted to highlight the wonderful work that you and your department and your staff have been doing. So that's the reason, and we welcome you here this morning.
Oh, well, thank you so much. We've appreciated some real partnerships that we've had with Orient Road, and especially the Sheriff's Office, your office, almost everyone in the provider community that deals with opioids and deals with substance abuse has been involved in our program. And our major leader on this project is going to be one of our private partners, which is going to be Phoenix House. And it's going to be also use ACTS, and it's going to use Tampa Crossroads. And we'll also be working with Grace Point, and we'll be working with ACO. So this is really a pretty cool project in terms of the kind of partnership that we have. It's private and public. So let's go into it just a little bit. It's a first-time pilot program that's innovative. We think it's cost-effective. It's for a community-based step-down respite facility in Hillsborough County. What we're hoping to open it up on, providing we can get zoning and a couple of other things that we need to get done, it's going to be done at 1800 Orient Road. It's basically expected opening date would be the fourth quarter 2020. Its purpose is to assist individuals with substance abuse and behavioral health issues that are transitioning from the jail back into our community, leaving Baker Act or individuals exiting local hospitals who are Hillsborough County Healthcare Plan members. The project's being funded in the expertise together with Hillsborough County's Commissioners, Sheriff's Department, Healthcare Services, Central Florida Behavioral Health Network, faith-based organizations, community substance abuse, and mental health providers and other stakeholders. We determined there was a need for, in the county jails and prisons are the largest providers of behavioral health in the United States. Individuals with behavioral health issues have challenges during the reintegration phase, and recidivism is common. This has been identified as an issue in Hillsborough County, and it's a unique group of stakeholders in a meeting to do something different. The Orient Road project has brought providers, other stakeholders to address the issues faced by individuals leaving the jail or exiting local hospitals. So the concept, and I just want to mention a couple of things that we did pre this project. If you remember, we got rid of, we increased the eligibility to 138% with the Board of County Commissioners' help. We also removed the 3 strikes felony that was prohibiting people from getting on the plan. And then what we did was we basically put 2 case managers, or we paid for 2 case manager services in the jail. And the reason that we did that is because I didn't want them going out anymore with 3 days worth of medications and into the community and hope that they would do well after that. So what we did was basically we said, okay, if they have 30 days worth of medications, that would be much better. And so what we did was we put all the providers in the behavioral health group that service the jail on our provider plan as participating providers, and then allowed them to write prescriptions for 30 days. The second thing that we did was we put the enrollment, we put an enrollment person there now that we could enroll people that were not eligible for the plan before into the program. And so we did that, and by doing that, we basically got almost 400 people right away that had been turned down before. And then as far as people going to go into the Orient Road, now they'll be able to be eligible for our Hillsborough County healthcare plan before they leave the place. So then if you get into the step-down unit, which we're trying to do now, we've gotten a partnership with Phoenix House, and I've told you the other ones, and basically Phoenix House, and then we're going to basically pay to rebuild it inside so that it really meets the requirements of a DCF level 2 beds, which will allow them to stay there from 60 to 120 days. And what that will do is that'll basically give them more time to transition into the community, and we'll be able to give them behavioral health counseling while they're there. They'll get 10 hours a week for every individual that is in that program. It is going to be voluntary. It'll serve up to 480 people annually with those 120 beds that we're going to put in there. And it's for individuals with a primary diagnosis of substance abuse with potentially co-occurring mental health diagnosis. That's key because you do have to have the primary diagnosis of actually a drug abuse or some kind of substance abuse. But we talked to the behavioral health group that treats the individuals in the jail, and they say they'll fill this up. Okay? And I'm also told that the hospitals basically have people in their places, they have no place to put them, and this would also give them an avenue as well. And then finally, Baker Act, we put some beds out into the community, which are 42 beds that basically take some of the Baker Act that would be just put back on the street, or now actually can go into some beds now that we weren't doing before. And that's all part, and this is all part of the plan of action and milestones that Commissioner Merman led for the opioid plan of action that we were trying to do in Hillsborough County. And so this is one part of that continuum. It's voluntary participation, but the reason that we think it'll be attractive is because we've added all the social determinants around it. So do you guys know what I mean by that? So I see blank. So social determinants are a recognition that when healthcare, get healthcare, basically that counts for about 20% of your well-being. The rest of it is environmental, it's behavioral things, and then it's basically, it's all about how you live, your wellness, all those kind of things. And so obstacles like transportation can cause you a problem. Housing can cause you a problem. So those are kinds of things that we're talking about when we talk about social determinants. So these are the partnerships right here. Hillsborough County Sheriff's Department, Central Florida Behavioral Health, you can read them all, and we'll provide you a copy of this. But basically, this is really a pretty good partnership. It's the first one, I think, of this kind that's basically trying to address the overall program. So The services that examples would include primary care and specialty, group treatment, OJT training, educational classes, peer support, telehealth, SOAR program. Does everybody know what the SOAR program is? It's a program that says, there's two tracks. We say on the one side, there's social services where we want to get them self-sufficient, right? They want to be productive citizens and those things. But there is another group that basically is in the other track, and that track is they just have behavioral health problems or behavioral health, mental health issues that they just are never going to be self-sufficient. So you want to identify those people and make them and get them on disability. So what our SOAR program does that we put into place as part of this plan of action and other things, the SOAR program is basically getting people on disability within 68 days. The norm in Florida is 2 years. Okay? The second thing is that we're doing it 85% success rate. It was so good that they flew our manager to San Francisco to go through their leadership program and made him the lead in this area. And he's doing really well, and we've got them placed at very strategic places, and they're working. But one of those places will be this Orient Road. Transportation, we're going to use Sunshine Line. We're also going to look at doing things like, what's the two that everybody uses now? Uber and Lyft. As you can tell, I'm not a real user of it, but a lot of people are. And we think that we've seen some of the providers using it now as part of their program. So it's really kind of working. And then, basically, there's a bus stop out there. We just need to get somebody to turn it back on. And now, that doesn't mean that I get to do that, but we are trying, and Commissioner Merman is trying to help us with that. But, it has to do with business too, so you have to really consider that in the overall process. But if that doesn't get turned on, the other ones will pay for that for our group. Okay? Care coordination, we're going to have case managers right there. It's going to be 24/7. It's going to be a very good program for them to get there. We've met with people like Feeding Tampa Bay, Career Source, A. Brown. They are all going to work with us to provide on-the-job training, such as cooking classes. You can get truck driving training in Feeding Tampa Bay, all of those kind of things. Although I don't know that Phoenix House is here. Phoenix House is going to take the lead on it. We don't anticipate that we'll have to do the contracting. They will. We'll just pay them for the services and make them basically responsible for it, because we're not trying to be the government entity for it. We want them to do it. But we also want them to pay for the design and some of those things. So they've all agreed to do that, and we're going to do that probably for a 10-year lease. The Hillsborough County Healthcare Plan will pay for the services provided by, to those plan members, so that we get those things all the way around it. The other thing that we're going to try to do is put the wellness part in here, so that they have a place to exercise, they get nutritional counseling, they get all of those other things that they probably wouldn't get normally. But because we put this healthy living program in place, we already have the wellness specialists. We're going to send them out and do counseling. If there's VA pieces to it, we're going to do it. Another thing that we're going to do is basically, when you look at housing, once you get through with the program, you want to put them out into the community. We've got some agreement with the homeless to provide us some limited housing vouchers. And those vouchers are basically only for that program. So if they complete that program, then they can go into a permanent housing, or at least they'll have money to do that, and a voucher, providing we have some affordable housing to do it, recognizing that that is always an issue. And then we're going to work with them just to try to make them overall productive. And if they need help, then we're going to get them through the SOAR program, and that's kind of the way we're kind of approaching it. The other thing is we're going to use the Department of Health to do educational classes and some other things as well. And then there's, of course, we're going to try to introduce peer support as they start to get through those classes and things like that. So the jail diversion program is linked with the sheriff's office, state attorney, and public defender's office. It's, there's one HCP case manager, as we talked about, to do enrollments right now. If it gets more, we'll add them. Funds are provided to the 2 case managers for the pre-release program. You know, when I talked about the telehealth program, they'll be able to do stuff like talk to a psychiatrist, they'll be able to do things like if they need to talk to, like, we're going to kind of partner, I think, with our healthcare primary care providers, which is like our federally qualified health centers and TGH and St. Joseph. And what they're going to do there is we're basically going to try to get them to do physicals on them or whatever, you know, according to where they're going to go. The other thing is we want them to have a medical home right away. So we'll at least do that as part of this overall program to make sure they get assigned to wherever they live or where they're going to live. There's also a recidivism reduction grant received by the Criminal Justice and Grants Management Office, which is Rob. And basically, they've got a program for 45 individuals transitioning from the jail for the next 2 years as a partnership with the sheriff, Hillsborough County, and ACTS. We work really closely with Rob, and he's done just a really wonderful job of getting grants into the Hillsborough County and kind of leading us in those directions. And his emphasis is basically on what happens after they go out. And it's a longer term, like 12 months, isn't it, Rob, roughly?
Yes.
And so what we wanted to do was to have that 12-month linkage after that. And he's also got a couple of other things that they're trying to do. I think some people refer to it as a clubhouse, but I don't really like that term much, but I do like the overall concept. And I think that as long as we've got a continuum and as long as they have this additional case management and stuff, that they'll do very well. And then they have some place to go to kind of meet with their peers and things like that. The other thing that we're going to do is we need to evaluate it. We're going to evaluate it very closely. And we've already talking to Dr. Peterson at the University of South Florida, and she will actually provide basically an evaluation process for this program. And we are meeting already with some of the professors to basically design a program that would be able to evaluate it. And the thing that you want to do is you want to do that early, not later, because most people do the evaluation part after they got the program in place, and then they don't have all the data elements to do the evaluation. In this case, we are going to do that, and we are going to put them as part of our overall design and the evaluation and the program itself. So we are going to pay for that and do some things to try to make that a really good experience. So the goals are reduction in readmissions to the crisis stabilization units and detox services, reductions in criminal justice and law enforcement costs, and it'll be measured through pre and post measuring, monitoring reduced jail times and bookings, positive economic impact through gained employment, successful completion of treatment, see if they actually get a self-sufficiency, reduction in overutilization of our community resources. We find that this same population uses a ton of emergency room visits. We see they use a ton of the sheriff's office responsibilities, not counting the other ones. And basically we see a lot of people going into criminal activities they wouldn't have ordinarily done if they had this kind of program. So we really do hope that we'll reduce all of that. And not only that, we hope to reduce the overall suicide rates and some other things that are occurring. The other thing I want to mention on this is that we've put 10 beds designated for veterans. So I wanted you to be aware of that. And we're going to work with the veterans groups. And this will be very helpful for them. And we're going to work with the VA's liaison to basically make sure that we work that correctly and make that help. So we're leveraging funds and in-kind services from various funding sources and agencies. We're going to reduce the number of ER high utilizers. We hope to increase accessibility to treatment, residential, aftercare, MAT, and all of that. I will mention also that we basically have added our primary care and our behavioral health in co-located locations. So we force that. We won't pay for that if you're not co-located with a primary care provider. Why? Because they were silos, and we didn't like that. The second thing was that we wanted to have assessments at the primary care level, and as an example, they do an assessment for depression, they do it for anxiety, they do it for life traumas, and they do it for PSTD. And they have evidence-based guidelines that they use to do those assessments. And if they have an assessment where that turns positive, we will pay for 12 visits, and they get their behavioral health person's right there, and they get referred right over. They do an evaluation, and they move forward. But the ultimate goal here, is basically to evaluate it and maybe publish some of the findings. And it's also, the ultimate goal is to enhance the lives of the individuals and families. And we think that that's going to happen, and many, many people will become self-sufficient. This is really a second chance for them, and they're going to get a lot of wraparound services to do that. We're going to put like a little exercise facility, not a facility, but maybe some outside exercise equipment and things like that, so they'll be able to do that. So I think that that'll work really well too. It's not real expensive, but it's an important part of the overall thing that they do. So my final comments is that we appreciate everybody's support that's been in this partnership. We still have some things to do. We still have to do, on the step-down unit, we have to build it out inside. And it's mainly the showers. Have you ever seen the old movies with the gang showers, And, well, those don't really work out real well, so in today's world. So we see the most of the things that we're going to have to do is to make those more current. And then it's set up because it's pretty close to the reentry program. It's in the same building. So that makes it pretty nice as well. And then finally, the other part of it, it was set up originally kind of like a nursing stations and things like that. So when we took the providers through, it was done really well. So they've got 2 areas where they can watch everything, and it's just really, I think, a good thing. So, if we can fill it up and we can get people into the program, and if we get this right, and we show all these partnerships, and we get the community, which we have done, we are presenting this a lot to the communities to let them know what we're doing. And I think that when this is all said and done, with all the partnerships we have, many I see here, I think this will be a great program, and that's where we're at. I hope that explains it. Jean Early, I'm the Department Director for Healthcare Services.
And Jean, you'll be providing this PowerPoint to Ms. Preza so that she can send it out to all of us?
I absolutely will. We brought 10 copies, and we saw,
Save
but
paper.
really, I think paper is too much for you. I think we're just going to send it out to the group. We'll send it to Rob, and he can send it out.
Questions,
If he doesn't
comments?
mind. Rob's been kind of controlling the.
Mr. Parkinson?
I just wanted to comment how much we appreciate Hillsborough County Healthcare and everything that they've done to support the work of this group. Over the last 10 years, we've done a lot to divert persons with behavioral health issues from the jail. We've done a lot to help them transition back in the community. A lot of our projects have been pilot projects funded with grant funds from either the federal government or the state government. After 3 or 4 years, we need to think, how are we going to continue this level of effort? And for the most part, it's been Mr. Early and his staff that have stepped forward to make sure that those programs continue to be as successful as they have in the past. I think back to 05, 06, when we were running about 4,500 people in the jail every day, people sleeping on little portable boats, and now we're down to 2,800, 3,200. This is a good time to be in the criminal justice system, and every day we develop a new innovation to help folks transition back in the community and lead a successful life. Also, I'd like to recognize Mr. Early for his work in developing the SOAR team. SOAR is an acronym for Social Security Outreach and Access to Recovery. And basically, we have a lot of folks that are out in the community, whether homeless or ending up in the jail, that should be eligible for Medicaid, Medicare, Social Security, either SSI or SSDI, but they have just not fallen into a place where someone can help them go through that very long and bureaucratic process to get access to it. And Mr. Early had the foresight to put a team together to focus specifically on that, and they have been incredibly successful. The other thing is that folks who go into jail are no longer eligible for their SSI, SSDI, and Medicaid. The feds are alerted that they're in jail, and it's basically suspended. Well, we have a fairly robust system to identify the feds when that happens. We don't have a great system to identify on the back end when they get released. And Gene's staff have been instrumental in making sure that folks get access to that. And what does that mean? That means they get their Social Security so they can pay for their housing, they can pay for their daily assistive care needs. And that has really helped in stopping the revolving door. And again, this is a great program, and it's focusing on post-sentence and reentry folks. But the work that Mr. Early and his staff have done to help support the diversion side, to expand our diversion efforts, have been nothing short of Herculean. Just really appreciative for your work.
I paid him on that, you know.
Well, I was going to say, obviously, on behalf of the Public Defender's Office, as you know, you engage and interact with
do.
Marie Marino
I do a lot.
hourly, maybe by minutes, every single day. And I know that she and Renee Marotti have worked very, very closely
We have.
with you, and Renee obviously is with Mr. Warren's office. I know that the two of them have really, they're both been very excited about all the efforts and everything that we're moving forward. So on behalf of my office, I certainly want to thank you also, because our clients are tremendously benefiting from this, from just every single, even the misdemeanor clientele that's been problematic, that we haven't been able to provide services to. It's the step up that you have done. Obviously, the support of Commissioner Merman has been tremendous, and so on behalf of our office, we certainly thank you.
I really appreciate that. I will want to mention one more thing. We're going to go this year, and Commissioner Merman is sort of doing the lead on this, but we're doing it in coordination with the Florida Behavioral Health Network. We are asking for 30 SRT beds in Hillsborough County. They have not done them in the past, and we have got to get those put into Hillsborough County on a recurring basis. It was done, it was basically stopped about 3 or 4 or 5 years ago, and we are going out with our government relations folks and with everybody, because there's a group of people that fall in this category of you can't benefit from substance abuse because you're not mentally stable, and you can't benefit from Grace Point or any of those programs because you're not. And so what happens is those people have no place to go, and you can't do anything with them, and then they keep getting arrested, they keep getting all of these different private programs, and it's terrible. So what we want to do is have 30 beds that they, and basically, because we don't have the full capacity yet, it'll be like 15, and then maybe we'd have to phase in the other 15. We do have identified 15 right away, and then we would probably do the next year the 15, but we want 30. And Central Florida Behavioral Health Network, who's the state group, they're also going in for beds, but we're basically targeting 30 for Hillsborough County, and any support we can get for that is, I think, important. I mean, I get calls all the time that says, hey, you know, they've arrested this person again, and then they either go into jail, or they are basically in the hospital and they can't keep them. It's too expensive. So as soon as they basically stabilize them, they're out on the street again. They get Baker Acted. I have had people calling me that have 13 Baker Acts, you know, and those are the kind of things that happen every day. And so we need to have these SRT beds because it's the only thing that will solve some of the problems. And the other thing is, those people that should be in SRT beds are taking up your crisis stabilization beds. So we really have got to get this part done. So any support that you guys show for that would be really helpful. And those are my final comments.
Would it be helpful to have a letter from the Public Safety Coordinating Council for this support? Mr.
Absolutely.
I think that would definitely be helpful for our local legislative delegation, and of course, when you individually meet with them, or as a group, as you often do, to continue to spread that message. Short-term residential treatment facilities are permitted under the Baker Act. These are for folks that need longer-term stabilization. Unfortunately, the state defunded them circa 2011, 2012, and what that meant, and we had about 40, give or take, here in Hillsborough County, 40 beds. What it meant is they had to stay in our existing crisis stabilization units that have an average length of stay of usually 3 to 5 days. So we have a lot of people either being discharged that shouldn't be discharged, or we have folks shifting over from local treatment to treatment at state level, either with a civil state hospitalization or possibly even being discharged and picking up a felony charge and falling under Chapter 916 as incompetent to proceed or not guilty by reason of insanity. This group has heard on that issue this year a number of times, and this all ties into that issue. If we have the capacity to deliver longer-term treatment, we have a much greater capability to stabilize those individuals here.
And the people that are waiting to get into crisis stabilization beds aren't being treated because they can't get into them. So, because you've got them with these other individuals. So those are my only comments. A letter of support would be most appreciated, Ms. Holt. And we're going to try to get one from the sheriff's office and everyone else, because the more you have on it, the better off we have and a better chance we have. I really think that there is a climate up there in the state legislature right now that says, and I'm definitely not the politician, but I think that there is a recognition at the state levels, it appears to be, that mental health is a major issue. The governor's office seems to be very supportive of it, especially the First Lady there. And so there's a number of things that seem to be coming together, and this seems like the right time to do it. So thank you very much.
If we could entertain a motion.
So moved.
Mr. Warren moves that we write a letter of support. Is there a second?
Second.
A second by Mr. Bates. Discussion on the motion. And Mr. Parkinson, would you be willing to draft that letter for us?
I absolutely can.
All right. All in favor of the motion, please say aye.
Aye.
Anyone opposed? Okay. All right, thank you very much. And then obviously, if we want to write letters in our own individual capacities also, Mr.
would be
Early would
great.
certainly be willing to accept those, and I'm sure we'll all take the message back to our respective agencies.
Right, and we'll take them to our government relations as well. And I know that right now, Grace Point is for that, DACO is for that, all of the ones we talked about today. Because I had them all in a room. I had like 60 people in that room. And I said, is there anybody in here that doesn't think we need an SRT bed or SRT beds? And there wasn't a soul that said no, and they all said yes. So it was unanimous that Hillsborough County needs it. So all your basic providers of mental health and of substance abuse are for this, so.
All right, and what we'll also do, I'll make a call out to Senator Roussan, and I'll see about getting an appointment, and I'll take maybe Mr. Parkinson with me.
Great, that'd be wonderful.
We'll make an extra little effort.
Thank you, I appreciate it.
You're very welcome, and thank you again on behalf of our office and really our community as a whole. We really thank you.
Yes.
Have a good day.
Okay.
Next we have, is Lawrence Storch available for me? And this is with regards to the Hillsborough Office of Operations and Legislative Affairs Criminal Justice Legislation Update. At our Executive Council meeting, we had asked that we be briefed a little bit on any pending legislation that might impact Hillsborough County in any way whatsoever, so that we could see whether or not we should take any action as a council. And this was, again, also at the suggestion and recommendation and with the consent of Commissioner Merman, who is on the Board of County Commission. Good morning.
Good morning. Thank you, Madam Chair and members of the council. I just got back from Tallahassee late last night, so sorry if I look a little ragged. In the world of, actually, Gene provided, oh, he left already. He provided a great segue for me in terms of kind of giving an overview of the legislative session and bills that are kind of moving through. I'm sorry? Lauren Storch. Yeah, brief introduction. I just joined the Legislative Affairs Office a few months ago. I previously was with the Criminal Justice Committee in the Senate. So this is sort of my wheelhouse. Rob and I have bonded over juvenile justice issues and different things of that nature. And Gene, as he was mentioning, I think really hit the nail on the head. Mental health seems to be a pretty big issue that they're trying to tackle this year. This session, I don't know how well-versed the council is on session in general, but this is a an election year. Obviously, you guys know that, but so session will be January to March this year, and election years can be kind of hit or miss. Sometimes they want to move things really quickly, and sometimes they don't want to make waves at all. So it'll be kind of interesting to see what the climate will be once session starts in January. Yesterday was the conclusion of committee week number 5. They will have another one in mid-December, and then they will be on break until session starts January 14th. So in the world of meeting with elected officials, you kind of have a very short window of time to kind of get your point across. So in the spirit of that, I plan to keep my presentation pretty short and sweet. I just went ahead and we have a tool that we use called Lobby Tools. And that enables us to track statutes that are relevant to what we need to focus on. So at Rob's direction, I sort of just started tracking all of the chapters that are relevant to your council, dealing with juvenile justice, mental health, incarcerated mental health defendants, all that, direct file, anything like that. So I just went ahead and compiled the bills that are already filed. And again, I don't know how knowledgeable you all are on session in general and how bills become law, but in order for something to actually become codified, there needs to be the identical language that passes in both the House and the Senate. So if you'll see, I wrote HB, and that's the bill in the House, and then the Senate bill is obviously the one in the Senate. And if you see where it says no companion, that means that there isn't anything filed at this time in the other chamber. But that doesn't mean that it won't be. That doesn't mean that that language in that bill won't get put on to another bill. It's kind of how the process works. It can be crazy, and many things happen in the last 48 hours. So that's always fun. But as Jean was saying, you'll see there are a few bills here that deal with mental illness. There's a push for defining this first episode psychosis. It's not codified anywhere in statute, so there's been a few bills that have been filed that are making strides towards defining that. They actually heard a bill the other day in Children, Family, and Elder Affairs in the Senate dealing with that, and also just a big mental health reform bill over there. So that'll be good to watch. The chair of that committee, Senator Book, is mental health and children and welfare and all that is really her MO. So she's always pushing on that. And there are, I mentioned direct file is another thing. That's something that we see pretty much every year. There's a bill filed to try and limit the number of juveniles who are transferred to adult court, trying to narrow that criteria that could result in them getting transferred. And that one always gains momentum. It kind of ends up being a little bit of a bargaining chip towards the end of session. There is a repeat bill in here about limiting the use or eliminating altogether the use of solitary for juveniles. And there's actually a bill that was filed for eliminating solitary for inmates as well in prison. So there's definitely a push in that, and that sort of goes hand in hand with the mental state of those who are incarcerated. So again, sort of just kind of repeating that whole mantra that mental health rather, seems to be a big priority this year on both sides of the aisle. There's been some legislation filed dealing with RPOs, risk protection orders, and trying to, again, that sort of just kind of is in that same overall umbrella of trying to narrow in on how we can help people who may be showing signs of mental illness and helping to protect those around them. And lots of firearm and weapon bills are going to be definitely filed this year. But again, just because it is an election year, it can be a little bit of a toss-up as to whether or not a lot of things move or nothing, and people kind of just try to maintain status quo. The Senate president designate and the House leader, those are going to be the ones that you'll see kind of trying to make they're going to be sort of taking the front seat this session, even though they're not technically the sitting presidents. That's just, again, kind of how the process works. Now I'm getting into sort of the minutia of the process, so I don't want to bore you all. But that is kind of my overview of sort of where the process is at right now. Probably won't be too much going on until January 14th, which is obviously when everyone will be in full force. But I plan to kind of keep this list running and add to it as other bills of interest are filed. And we'll see kind of what happens and what moves and what dies. And hopefully there will be some reform that they will be happy with.
Lauren, could you also provide this to Ms. Preza through email so that she could forward it to the rest of us?
Absolutely, yeah, no problem. And I'll probably transition it to an Excel spreadsheet just for ease of tracking purposes. And if there's any in specific that are of interest to you guys specifically, I can certainly pull up an analysis and shoot you a summary of kind of what's happening with it all. As these are heard in committee, obviously that's when people sort of perk their ears up and start to throw their hats in as to whether they support it or not, so.
Mr. Bates?
No, I was going to ask you to get
Same thing.
copies of everything, so.
Mr. Warren?
Lauren, thank you very much for the overview. I think a lot of our agencies, if not most of them, have eyes and ears on the ground in Tallahassee. But I think it'd be helpful for the council if we get your take on what you see is likely to move.
I had a feeling that was gonna be asked.
Won't hold you to the prediction, just.
Yeah, off the record, it's really hard to say because I do think, truthfully, mental illness is a huge focus and frankly is a partisan, or rather a nonpartisan issue. I think we may see some expansion of the RPOs in terms of how those are sort of implemented and regulated and enforced, just because that's such a hot button issue right now. I don't know, your ears perked up at that. You might not agree with me, but.
Ms. Storch, I just want to remind you that this is televised and recorded on Hillsborough TV. So.
Oh, wonderful. I said off the record. But truthfully, it's really hard to say. The direct file bills usually do gain some traction, but I just don't know. It's an election year. It's really tough to forecast that kind of stuff. So it's the best I can give you.
I think our agencies have the same difficulties in forecasting what's going to move.
Exactly.
That's why we wanted your expertise on it.
It's hard to say, but I will certainly keep you guys abreast of anything that I think is of interest, and anything else that you want me to sort of follow, I'm happy to do that, so.
Well, it'd be great if you could let us know if you start hearing anything about, moving bills is great, but if you hear anything about money that's available for enhancements for our problem-solving courts, that would really be great. And if you hear about someone in particular that we should talk to, because We have our juvenile mental health court, an adult mental health court. We have our veterans court, which is growing and growing and growing. And then obviously, we've had drug courts for a long time also, but a lot of times people think that Hillsborough County has these things and we're good to go. And the reality of it is we have created a lot of these courts on our own backs and really could use some additional funding for things. At least that's the position of the public defender.
I can chime in.
And Ms. Justice will chime in at this time, but that would really be of benefit to us because you'll hear, I know from my colleagues, they go, well, you already have this and you already have this. I said, yes, but we have handled it all internally with our own budgets, and we never really got that full funding part of life. At least that's how I feel about the resources I've put into it. I've gotten a lot more financial support from the county part of life. So that would be of benefit to us, and if you just get that information to Rob, then he can get it out to all of us. Ms. Justice?
I'm not the chief judge, I'm not Ron Ficarota, but I'm the court administrator, and I can speak to a lot of the budgetary issues as it pertains to problem-solving courts. In particular, mental health court is very juvenile at its stance today. It's 2 years in for adults, less than a year in for juveniles. However, it's growing and growing with no real funding stream, to be quite honest with you. Services, as you know, are expensive. There's tremendous effort and spotlight right now to try to do more for the individuals in all of our communities across the state who have mental health needs and, in particular, co-occurring disorders. So a plug is said officially on the record now that is a funding stream of need. I can also speak to the fact that, as Ms. Holt mentioned, our Veterans Treatment Court is one of our problem-solving courts that has the most long-term growth history. It's still on an upward trajectory, and we were being funded almost entirely over the last 3 years with a SAMHSA grant. It sunsetted this summer. We were able to tap a small pool of unused SAMHSA resources and roll it into the first and second quarter of this year. But the clock is ticking, and the first quarter and second quarter are short periods of time when you talk about our overall needs for that problem-solving court. Enrollment is high because expansion has occurred. And so we have a long-term need to be able to find a permanent or more stabilized revenue stream for that problem-solving court as well. So thank you for giving me the opportunity, Ms. Holt. And thank you for being here.
Mr. Parkinson?
Ms. Holtz, in a previous meeting, you had expressed some concern regarding the physical condition of some of the juvenile justice facilities in the state. Of course, of key concern is our ones here in Hillsborough County. So is that something you would also like Lauren to keep an eye out on and possibly advocate for?
Absolutely. And I'd love to take you on a tour of the detention center so that when you're speaking to people, you can give them your firsthand experience.
I've been to one, and it was definitely an eye-opening experience, but I'd be happy to come along for visits of other ones. And I know that Representative Hart, she has made it one of her initiatives to look at the different facilities and try and identify ways that she can help improve them. So I know that has been a focus among some of the elected officials.
Be great. Thank you very much. Any other comments, questions, thoughts?
I just want to make sure that you're aware that Lauren's out there as a resource if you need to talk to her. In the past, our Legislative Affairs Department has brought on staff that had varying levels of expertise, stormwater, land use, et cetera. Lauren, in addition to having a law degree, comes to us from the Senate staff. So she is keenly in tune with a lot of the relevant issues, and she's definitely somebody who will understand our perspective and will be able to articulate and advocate for our needs.
That'd be great. Thank you so very much. We really appreciate you coming this morning, and especially I know you probably had a late night last night, so thank you so
Okay,
much.
it's the nature of the beast. Thank you so much for having me.
All right. Yes, ma'am. Which then takes us into the subject that we usually try to have right before the legislative session starts, which is, are any agencies having any types of legislative budget requests that they've made, that they feel that they need the support of the council in any way whatsoever, or are there any agencies that feel that this council should engage in what we just asked Lauren to do, which is follow up on financial issues, substantive issues that affect us. And obviously, we know about the courts, and Gina, at some point in time, if the chief judge and you create any type of written documentation where you'd like the council to also provide a letter of support, I'm sure that we could entertain a motion here today if you'd like to do something like that, because everybody that's sitting around the table benefits from all of our problem-solving courts. And all of us know the amount of resources we need. So if you think that's appropriate, we could have a motion today so that if you do need it for the session, you'll have it available.
Would it be possible for me to speak to the chief judge about it and get back to you on that accord?
Yes.
I'd appreciate that, thank you.
If the council would then give me permission to send any such letter, if the chief judge were to ask for it, so long as everybody sees the draft of the letter before I sign it. Yes? Would everybody be okay with that?
Yes.
All right.
Thank you so much.
Anybody else? Right. Then there is no other business at this point unless someone wants to bring some particular subject up. Ms. President and I received an email from Al McCray, who wanted us to say hello to everybody on the council. He missed the executive council meeting, and he's missing today, and it's only because he is unable to travel here because of some medical situations, and he authorized me to tell everybody that, but he did send his regards and asked us to continue working hard on behalf of the community. Any other public comment? And we obviously wish Mr. McCray a speedy recovery and miss his appearances before us. Then I'll entertain a motion for an adjournment if anyone has one. Motion to adjourn by Mr. Bates.
Second.
Thank you, Ms. Justice.